I'm Professor Jean-Michel Halimii, head of the Department of Nephrology and of the Thrombotic Competence Center at the Tours University Hospital. Patients with thrombotic microangiopathy, or TMA, usually have kidney dysfunction, and TMA is usually caused by drugs, atypical HUS, and chigatoxin E. coli HUS. We tend to believe that atypical HUS is the most frequent cause. However, when we consult with other physicians, their TMA patients are somewhat different. For example, critical care physicians deal with patients with the most severe form of TMA, like TTP, whereas hematologists take care of patients with TMA-associated stem cell transplantation. It is therefore difficult to have a clear estimation of the frequency of different TMAs and their respective biological and clinical characteristics and outcomes. We therefore decided to include all consecutive patients with TMA during a period of 9 years, from 2009 to 2016. 4 physicians reviewed the cases, and all relevant cases were adjudicated by 3 experimented physicians who are members of TMA competence centers in France, namely Rennes, Nantes, and Tours, France. During the study period, 564 patients presented with TMAs, but the rate of primary TMAs was only 6% of all patients. The most frequent cause of secondary TMA was pregnancy-associated TMA. Half of patients with secondary TMA had multiple causes. For instance, patients could have infection not related to E. coli chigatoxin, cancer, and suspected drugs at the same time. Virtually all patients had schizocytes, high LDH, anemia, and low platelet counts. But there were some differences according to the causes of TMA. Clinical characteristics varied by the cause of TMA. Diarrhea was present in many patients regardless of the cause of TMA. We also observed that patients with TMAs were admitted in 19 different medical and surgical departments, which suggests that some physicians dealing with these patients are used to taking care of them, but some are not. This probably explains why the diagnostic workup was not complete in many patients. Finally, we also confirmed that TMA remains a serious disease. 15% required dialysis, 11% had major cardiovascular events, and 10% died during hospitalization.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.